Good morning, everybody. Happy Monday. This is May 10th, and this is the Anchorage Emergency Operations Center update. We'll do a quick roll call. Big thank you to all those involved in Vaccine Week last week. I know it was fun following along on Facebook and YouTube, all the little live pop-ups and the different places we were able to get to, and looking forward to a hot wash on Thursday to really wrap our arms around the success of that event. So if you played a part of that or got somebody to go to it, thank you very much for that. And AJ, can we get an update, please?
Yes, sir. So today is day 432 of the response. There's been 137 new cases in Anchorage, 0 deaths, and up 42 hospitalizations. For 213 RRs, there's been 1,750 filled or satisfied, which is 0 since the last report, and there are 16 open and working. All right. In the past 72 hours, there have been 27 non-critical transports. In the last 24 hours, there have been 4 after hours. For Congrit, we have 406 clients. We are up 20 there. For non-Congrit, there are 305, which is down 11, for a grand total of 711. Total clients, 9. Since May 3rd, there have been 4,055 samples collected for testing, and the vaccines are still being updated currently. And once that is up to date, I will update these slides and distribute. That is the end of my report.
Thank you, AJ. Weather.
Yes, good morning, everyone. Caitlin here with the National Weather Service. Looking like a pretty quiet week overall. This morning, we do have some gusty southeasterly winds, mostly across the southern portion of town. We are expecting those to taper off by the evening hours tonight. And we're looking at just generally cloudy skies and some scattered showers throughout the week with a chance for some rain on Tuesday and Thursday, but pretty much just cloudy overall. And that's all I've got. Thank you.
Good morning, everyone. It's Pat Ryder, Deputy Ops Section Chief. Today with Mass Care, our Q&I location has 9 projected discharges through Wednesday. That's to include 2 discharges today. And just to reiterate from last week, our warming tent has now been demobilized. With public health, the hours at the Elmore testing site will be decreasing to the hours of 10 a.m. to 6 p.m. That'll be beginning May 17th. Visit Healthcare will be adding Sunday testing to the Lusac Library site. That'll be beginning May 16th with hours of 10 a.m. to 4 p.m. Visit Healthcare testing had a decrease of 6.95% over the previous week. Our 7-day rolling positivity rate average is 1.65% as of May 6th. Our 14-day average reproductive rate is 0.839. Our 14-day average case rate is 11.42 for every 100,000 people in the population. With pop-up testing, on May 15th, we have Muldoon Elementary School from 8 a.m. to 7 p.m. With medical countermeasures, with our vaccine week, in total, we administered 2,700 doses at our Muni-run clinics. We're also preparing for the authorization of the Pfizer vaccine for ages 12 and above. That'll be voted on by the CDC, which is scheduled to meet on Wednesday. Diamond Visit is now offering, the site at our Diamond location is now offering all 3 types of vaccines, to include both the first and the second dose for Moderna and Pfizer. And this will be open daily from 10 a.m. to 8 p.m. And finally, just a reminder, we are seeking mobile clinic requests, so we can bring the vaccine directly to your organization, workplace, church, or community center. To schedule, please click on the vaccine tab on the municipal website, or you can dial 907-531-5100. Barring any questions, and a report.
Great. Thank you, Patrick. Logistics.
Hello, it's Scott Carpenter over in the EOC Logistics. Here's our continuing lines of effort. You heard Pat say that we closed down the warming tent, so we continue to demobilize and return those assets to where they belong, as well as prepare the Fairview Rec Center for its closure. This is all in support of Mass Care. For medical countermeasures, we continue to work on the second vaccine week and any of the additional requirements for other vaccination sites. And as far as additional support is concerned, we continue to work staffing requests and support to the Northway Association events for medical countermeasures and public information. Pending any questions, end of the logistics report.
All right, thanks, Scott. Finance.
Good morning. This is Carrie Wiedeker, the EOC Finance Section Chief. Currently, the EOC has encumbered $19,689,957. Our actual spent to date is that's $50,831,104 for a total of that's $70,521,061. Please continue submitting any invoices and supporting documentation to eocinvoices@anchorageak.gov. Outside of the EOC, the Office of Emergency Management does continue to seek cost recovery by way of FEMA public assistance. Please contact Erin Zachary if you have any questions related to that. End of report.
Thank you, Carrie. Safety.
Happy Monday, everyone. This is Safety Officer Aaron Carter filling in for Annalisa Roberts. She's currently having technology issues. It's that time of the year. May is Motorcycle Safety Awareness Month, so I'd like to give a friendly reminder that motorcycle riders have several disadvantages when operating in traffic, such as lack of seatbelts, the instability of a two-wheel vehicle, and low visibility in traffic situations. Also, motorcycles are small and difficult to see. They have a much smaller profile than autos, which can make it more difficult to judge their speed and distance. So, friendly tip, always signal your intentions before changing lanes or merging. This allows the motorcyclist to anticipate traffic flow and find a safe lane position. Motorcyclists are often hidden in a vehicle's blind spot or missed in a quick look due to their smaller size. Always make a visual check for motorcycles by checking your mirrors, blind spots before entering or leaving traffic lane, and especially at intersections. For you motorcyclists out there, always keep your bike in good working condition, obey all traffic laws, maintain good situational awareness, and always wear your PPE. For more information, you can go to the State of Alaska's website for the DMV or the Motorcycle Safety Foundation. This concludes my briefing. Thank you very much.
Thank you, Aaron. Good stuff. Public information.
Good morning, everybody. Cale Casey here reporting out for the EOC Public Information crew. We are working on a flyer for pop-up clinic later this week on Thursday from 4 to 8:30. We're also confirming our details for our next Overcoming Hesitancy event on May 15th at the Northway Mall, sharing flyers, translations, and vaccine and testing appointments with our community. In addition, we'll be sharing updated and trying to clarify the masking requirements within the Muni, the CDC requirements, the EOC recommendation with the health department wording and all that, because it's really confusing right now. We're very aware of the fact that around Anchorage and the Mat-Su, and I'm assuming up in Fairbanks, very few people are observing the mask requirements, and we know that we need clarification there, and also how that impacts the under 12 age group who cannot get vaccinated right now. We're also going to be working on the 12 plus messaging. When the announcement is made, we'll be amplifying and sharing what Anchorage School District and the CDC has recommended. End report.
Thank you, Cale. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the EOC. I'd like to thank all of our partners who are able to join us today. I know Tracy with the Mat-Su Borough EOC has a report out, so I'll open the floor to her.
Hi, we're supporting public health nursing in the Mat-Su with 2 clinics this Friday, one in Wasilla, one in Talkeetna. For Talkeetna, we are circulating a flyer. Appointments are preferred, but walk-ins are welcome, and I'll post the direct appointment link to the chat. Thank you, and end of report.
Thank you, Tracy. And do we have any other cooperators on this morning that would like to report out? Okay, hearing none, we'll go on to the hospitals rather. And is Kirsten on for Alaska Native Medical Center?
Good morning, this is Kirsten Kolb with ANMC. Today we have 5 positives inpatient. 2 of those are in the ICU and both are on ventilators. 0 PUIs. End of report.
Thank you, Kirsten. And I believe Sean's on for Alaska Regional Hospital.
Good morning. Alaska Regional Hospital has 6 COVID positive patients, 2 in the ICU, no vents, and 1 PUI.
Thank you, Sean. And I believe Nikki is on for Providence Alaska Medical Center.
Yes, good morning. PAMC this morning has 11 COVID positive patients, 3 in ICU, 0 on mechanical ventilation, and 6 COVID recovered. Thank you.
Thank you, Nikki. And do we have anyone on for the 673rd Medical Group?
Good morning. This is Sergeant Perez with the 673rd Medical Group reporting on our vaccine numbers. As of Friday, we have administered a total of 16,747 vaccines, 8,995 of those being the first dose, and 7,752 being both doses. And any questions and a report?
Thank you very much, Sergeant Perez. And the Mat-Su Regional Medical Center is reporting 10 positive cases with 2 in the ICU, 2 on ventilators, and 0 PUIs. And that's all for Liaison. Thank you.
Thanks, Celeste. Anchorage Health Department.
Good morning, everyone. Kelly Biostock with Anchorage Health Department. The overall COVID-19 risk level has dropped slightly again this week, but still remains in the considerable risk category. What we're seeing is with 50% of eligible residents having completed the vaccine series, Anchorage is experiencing a situation where there's different subpopulations that are at very different risk levels related to COVID-19. So one is unvaccinated individuals. They continue to fall into the high risk category, while vaccinated individuals are in the lower risk category. So with fewer mandated restrictions, individuals, especially the unvaccinated ones, need to assess their own risk and regulate their own activities accordingly. Prevalence of more transmissible COVID-19 variants continues to increase nationally, and since our last report, there's been 4 additional cases of the B117 variant since last week. And lastly, the Pfizer vaccine will likely receive emergency use authorization for 12 to 15-year-olds this week. So we encourage families to talk about the vaccine with their children and make the plans to get vaccinated. Thank you. That is all from Health Department this morning.
And Commander.
Good morning. This is Incident Commander Bob Dole. As we go into a new IAP period, it's a point of some change for us as we transition out of a EOC structure into with a command structure into a coordinating role with the Anchorage Health Department, Development Services Department, and Office of Emergency Management, continuing to go forward as we prosecute the disaster response. Stepping out of the EOC incident management team structure does not mean we've declared victory. We're a long ways from there, and frankly, I think it should be pretty invisible in terms of a difference in terms of the delivery of services. The main thing it is doing, it reflects the reality that the complexity of the operations is at a point where it no longer requires a command structure as opposed to a coordinating structure. So we look forward to transitioning successfully into this next phase and continuing to get shots in arms and take care of those in need and swabs in noses. Thanks. End of report.
Thank you, Bob. May 13th, 10 a.m. is our next briefing, and look forward to seeing everybody there. Thanks, everybody. Have a great day.